Welcome to December and our 12 tips of December, or 12 things you should be doing in your office in December. I'm Laura, the founder of Front Office Rocks, and I'm here with two of my coaches, Lindsay and Missy, and we were discussing the things that most offices should be considering in the month of December. And we are on tip number 5 of 12. And this was one where it's not necessarily do this tip, but it's a discussion that your office should be having, and that is around increasing your fees. It is a good time of the year to decide about increasing your fees. We close for the holidays, we open up, we start back to work, and it's a perfect time to analyze where you are with your fees and where you should be with your fees. So Missy, I'll let you start. What are your thoughts on increasing fees? Because that's a nerve-wracking thing for a lot of offices.
Sure. Well, you need to do it. I think you need to do it just because it's what is done. Also, during this time, our costs have increased. And so we need to somehow recoup. I think some people get afraid of it, but I think we should be really confident in everything that we're bringing to patients. And there's a fee with that. And so I think ideally, if you're not sure where you are, then you should check with one of your reps. They can give you an idea of fees in the area. And then you can decide how much you're going to raise the fees. But I definitely think it's something you need to think about and do.
And Lindsay, tell me about you and your thoughts on that.
My thoughts are, if you can do an increase or you're thinking about doing an increase, just do a small across the board increase, 1 or 2%. Like Missy said, get the comparison, see where you stand. But it's easy to update your software by putting a percentage in and just boom, clicking the button versus going over every single code that you have in your system.
And I would say for me, probably the person that is the most resistant to increasing fees are the dentist. So we need to talk to our dentist as business owners about the cost of everything else is going up. The second thing I would say, and again, these are just tips for you to talk about in your office. Lindsay and I kind of look at it differently. I don't know that I would do an across the board increase. What we've done in the past was we picked certain procedures that we compared our fees to the area, and then we increased on those. So not across the board, because patients see prophy fees all the time and they might notice that difference, but they're not going to notice an additional few dollars on a crown. So just having some fees go up. So you can get help with fee analysis, but definitely don't just do the same thing over and over again and expect a different result. You are a business. It costs more to do your business. It costs more to grow. And this is a good time to have that discussion. So make sure you're not avoiding it. Make sure you're looking at it. And I'll tell you, in our office, every year when we did a fee increase, the dentist would leave and say, fine, just go push that button like Lindsay's talking about. Go do it. And it'd be January 20th. And they'd be like, wow, nobody's even said anything. So I think many times we're more afraid than honestly the patients even notice. So make sure you're having that discussion and that you integrate a fee increase or a plan for it in the next upcoming months. So there's our next tip, and we will see you soon on our tip number 6.